From supine to side lying, from side lying to row, and vice versa. Okay. Now, it's very important that when you are moving your patient's head, you need to make sure that you're able to position the arms, the upper extremity and the lower extremity properly in a way na hindi siya maikip, really awkward ni patient, and really put ma-injure si patient. Now, yesterday, I sent the lecture on body mechanics. Can you give me all those factors affecting your balance and stability? Base of support. And where is the base of support located? Feet part. So it's the distance between your feet. Okay. So the wider your base of support, the greater your balance and stability. Okay. Next factor affecting balance and stability is your center of gravity. So what is a center? Where is your center of gravity located? Second sacral segment. Okay. So that's your COG. And how do you maintain a stable center of gravity? By bending your knees and your hips. So you need to lower your COG to maintain balance and stability. Okay, next one. VGL, your vertical gravity line. So where is your VGL located from? Between the feet. So it's within the midline. Okay, so from the head, middle of the forehead, down to the nose, down to the umbilicus, and down to the floor. Your VGL, your vertical gravity line, should fall within where? COG. Within your COG and your base of support. Now, if your VGL moves to the edge of your base of support, balance pa ka or dili na? Dili na. If your VGL falls outside the base of support, what will happen? Fall. Okay, now pelvic inclination. Pelvic tilt. Two types of pelvic tilt. Anterior and posterior pelvic tilt. Now, when carrying an object, when you are to squat, what do you do? Anterior pelvic tilt or posterior pelvic tilt? Anterior pelvic tilt. When you're already carrying the object, what do you do? Anterior, posterior. Okay, so anterior and posterior pelvic tilt or your pelvic inclination also helps with the maintenance of your posture. Okay? So maklaman mo kung well-aligned ba, proper posture ba na. Now, when it comes to handling your patient, it is very important to apply proper body mechanics. Why? What's the main purpose of body mechanics? To
the injuries
avoid injuries, accidents, maintain balance. What else? Reduce fatigue. What else? Body balance and control. What else? Reduce fatigue. Yes. Dili kay kakapuyon. Why?
Reduce the energy required, miss.
Reduce the energy required. Nga naman ka. When we apply proper body mechanics, why do we reduce the energy required? Why does it reduce fatigue? Because you are using the proper way. Okay, you are using the proper muscles of the body when doing the different tasks, and you are moving in a coordinated manner. Okay? Coordinated manner. Now, during the return demo, guys, you will start, okay? So, kung mag-rep them na, mo start na ta. Start with a knock-knock. Assuming you're already a caregiver who is to handle your patient. Knock-knock, enter, and do your greetings and introduce yourself. So, munak-knock ta. Ano sa amin ta munak-knock? Of course, muna ay door. Masirado. Dahil sa kay munak-knock ang nakuhaan. Pagli ang puta. So, walay puta ka ni knock-knock. Wrong na dayon. Okay. So, yun na. Greet. Good morning, ma'am. Good morning, sir. I am Angel, and I am your caregiver. So, before you explain the eye, make sure that you identify the patient first. So, two patient identifier. If the patient is conscious and is able to talk, you ask the patient for his first and last name and the date of birth. Okay? Now, if the patient is unconscious, comatose, saba, so how will you identify the patient? That's through the chart and through the raised tablet. Okay? Now na ito, may nakabrace na tabi na muna sa hospital, no? Or naasa na sa institution. Now, if you are a live-in caregiver and you've been with the patient for a very long time, lahi sa kayo pangutangon pa niyo yung patient ay ang pangan. So, kadugay na ninyong nag-upan. You can do your greetings, you can do introduce. Will you still be introducing yourself?
No.
Okay. So, but this is the standard procedure, huh? So, let me just confirm you are Abigail Abajo. And your date of birth, ma'am, is when? Tingnan si ma'am, today is my birthday. Happy birthday. Ano ni mo? Today is my birthday. Ano sa date sa karon, ma'am? Yun siya, September 12. September 12, 1940. That's my birthday. Okay. So, what's next? So, today, ma'am, I will be moving, I'll be changing your position. You've been lying there in bed for almost 2 hours, so we need to change your position. Okay? So, inform ang patient, i-change na natin mong position, ma'am, in 2 hours na ta. You need to make sure na dili-init ang likod and para makaprevent sa magka-rashes ng mga likod. Simple explanation will do. Do not tell the patient, ma'am, because we are avoiding friction on her skin, and this friction will cause pressure sore. And you know what causes pressure sore? Asthma kaayo.
Para mag-discuss na.
And you know the only formula. So, just have to say, ma'am, I'm sure init na gamay mga likod. No? You need to change your position now, and that way I can check. I'll be able to check what's the condition of your back. Ana lang. Or we could probably do some back rubs, back massage if you want. Simple explanation. Now, do not forget, let me just excuse myself. I'll just wash my hands. Okay? So, during the return demo, I want you to wear your PPE gown, your mask, okay, and your gloves. You need to wear that. Ipos ang buhok sa mga babae. Okay? So, make sure you have your own PPE gown. Ayaw nang magulang-hulang. Sama ng PPE gown. A PPE gown is different from a lab gown. Kasi pag sulong mo, chumuha din ang gown. PPE gown. Na ay blue, na ay puti, na ay kuan. PPE gown. And then your gloves, you can use the surgical or the clean gloves. Itong gloves na ito, puti, violet, yellow, sa panang kuluran yung gusto. And then, make sure you have your mask. Okay? So, hand washing, let me just excuse myself. I'll just wash my hands and put on my PPE. So, that's when you wear your PPE and then go back to the patient. So, I'll be changing your position from supine to side lying position. So, ma'am, you need to assess unsay kaya nga itabang ni madam. Kung kaya ni madam to move her body on either side of the bed, then let the patient do it. Kung unsay kaya, buhaton sa patient, let the patient do it. Okay? So, assuming si ma'am is one-able ni si ma'am, pero it's just that naalan dyan, mag-isod lang din na siya o naalan na siya gamay na assistance. Okay? I'll just remove your pillow, ma'am. I-remove na to ang pillow. Now, before you even start, you need to adjust the height of the bed. It should be at working height, waist level. Why? That is when your proper body mechanics is applied. Because in proper body mechanics, you are avoiding na di ma-injure ang back. So at least kung naka-elevate ang bed at a working height, you don't need to bend. So, adjust the bed, lock the wheels. Ayun sa kaya kaya sige gulong mo, nagdagandagan ang paan. Ang catering. Okay? And then, guys, when you are to move, sa ganito, widen your base of support, lower down the COJ. Kaya para, you are actually able to use the right muscles for that specific task. Okay. So, make sure, ma'am, ano siya ha? Guys, make sure that you inform the patient, ma'am, if ever you feel anything, feel dizzy, may laban yung ulo, or there's anything that you're complaining of, tell me, that way we can stop. Okay? So, you talk to your patient and then you do the counting, ha? So, let's say you're moving the patient, ma'am, at the count of 3, I want you to move your body towards me. So, and don't forget, side rails of the patient must be up. If ikaw rausa, wala kay partner, make sure that the opposite side rail is always up. Karing sa side mo, okay na naka-down na siya para masayon mo sa pag-move. And if you are to move to the other side of the bed, do not move without raising the side rails. Okay? That's for safety purposes. Okay. So now, how do I position the patient's upper extremity? So, assess which side of the body is weak, which side of the body is affected. Now, assuming my patient has a stroke, the right side of the body, the left side of the body is affected, is weak. So, meaning I will be turning the patient towards the opposite side. I will never turn the patient towards the affected side. Why? Wala naman ganit na-feel ang pika side. Mo pa yung panag-ugan. Okay? So, I will turn the patient towards the good side. Again, never turn the patient towards the affected side. Rather, turn the patient towards the good side. So, this is the good side. This is the right side. So, I will be turning the patient. Ma'am, before I turn you, let me just ask you, is it possible for you to move your body near the edge of the bed? Okay, ra? So, budong man siya na ako, no? So, let's say for example, guys, para ma-make sure nato nga kung naka-sideline na si patient, na yapon siya, naka-align yapon siya sa tunga sa bed, then you will be moving the patient either side. So, if towards diri siya sa ako, asa man ako i-move sa patient, asa nga side sa bed na move si patient. Para in-sideline niya, naa siya sa middle gihapon. Which side of the bed ako siya i-move?
Left.
Towards the right or towards the left?
Left.
Aray ko sa opposite side. Okay? Side rails up. So, how do we move the patient from side to side? Segmental. So, when I say segmental, first move na ko will be, I will be supporting the shoulder and the lower back. Anong mutong-tong mata, ma'am? Proper body mechanics always move closer to the object, no? Or your patient. Kaya balik ko diri. Tanawa. Na mag-anak ko.
Hindi mo ang
Drop. Padaol ko. Okay. So, when you support, guys, not the neck. It should be the shoulder ang inyong supportaan. Okay? And then, so, anilang sarap na. Okay. And then, okay. Okay. Since the patient is actually able to move, slightly move, I will ask the patient, ma'am, I want you to assist. I will be moving you towards me, okay? At the count of 3, 1, 2, 3. Very good. Then, second segment, here. Insert. Dire. And then, the other side, asa? Under the knee. Okay. So, guys, assuming lang, dili ni mayroon niya kung punang taas pa ang bed. Okay? So, insert na ka dire. Dire. Okay, let's move your buttocks towards me. And the count of 3, 1, 2, 3. Very good. Okay, the last one is under the knee and ankle. Alright. Na-move na ako siya. Okay, so one side of the bed. Now, I'll move towards the other side. Side rails up. Arm overhead. Affected leg over the unaffected leg. Why? Para i-turn na ko niya, di mahabilin ang weaker leg. Okay? I-cross na ko siya. Now, if ma'am, pwede ra di ana lang? Pwede ra?
Dili.
Dali.
Okay? Ano di mo pwede ra. So you have two options. Ako, mas ganahan ko yan. Okay? Now, I will then do log roll. So hold onto the shoulder, hold onto the hips, pakilid. Okay? Now, another option. Balik na ma'am. Butaran ako na ang unlan. Okay. Para comfortable na siya lahat. Okay, pakilid ako. So, side lying. And then I put all the support needed. Making sure na ka-identify ka sa mga bony prominences.
Shoulder dito siya. Shoulder. Sabi ako siya position.
Okay. So, patient is now on the side lying position. Okay? Right, ma'am? Thank you so much for cooperating. So, I'll be leaving you. I'll be back in 2 hours. We'll be changing your position again. Okay? Now, na ako'y nakalimtan. When you are to be doing any procedure with your patient, guys, always provide privacy. When you say privacy, is
Close
you
the
can
door.
close the privacy curtain or close the door. You lock the door, butang yung do not disturb na sign para wala magsinamok. Turn on the answering machine.